NCLEX RN practice test. Question 1. The nurse is caring for a client scheduled for removal of a pituitary tumor using the transsphenoidal approach. The nurse should be particularly alert to nasal congestion, abdominal tenderness, muscle tetany, oliguria. Removal of the pituitary gland is usually done by transsphenoidal approach through the nose. Nasal congestion further interferes with the airway. Question 2. A client with cancer is admitted to the oncology unit. Stat lab values revel hemoglobin 12.6, WBC 6500, K plus 1.9, uric acid 7.0, Na plus 136, and platelets 178,000. The nurse evaluates that the client is experiencing which of the following: hypernatremia, hypokalemia, myelosuppression, leukocytosis. Hypokalemia is evident from the lab values listed, K plus 1.9. The other laboratory findings are within normal limits. Question 3. A 24-year-old female client is scheduled for surgery in the morning. Which of the following is the primary responsibility of the nurse? Taking the vital signs, obtaining the permit, explaining the procedure, checking the lab work. The primary responsibility of the nurse is to take the vital signs before any surgery. Answers B, C, and D are the responsibility of the doctor. Question 4. The nurse is working in the emergency room when a client arrives with severe burns of the left arm, hands, face, and neck. Which action should receive priority? Starting in 4. Applying oxygen, obtaining blood gas, medicating the client for pain. The client with burns to the neck needs airway assessments and supplemental oxygen, so applying oxygen is priority. Question 5. The nurse is visiting a home health client with osteoporosis. The client has a new prescription for alendronate, Fosamax. Which instructions should be given to the client? Rest in bed after taking the medication for at least 30 minutes. Avoid rapid movements after taking the medication. Take medication with water only. Allow at least 1 hour between taking the medicine and taking other medications. Fosamax should be taken with water only. The client should also remain upright for at least 30 minutes after taking the medication. Question 6. The nurse is making initial rounds on a client with AC5 fracture and Crutchfield tongs. Which equipment should be kept at the bedside? A pair of forceps, a torque wrench, a pair or wire cutters, a screwdriver. A torque wrench is kept at the bedside to tighten and loosen the screws of Crutchfield tongs. Question 7. An infant weighs 7 pounds at birth. The expected weight by 1 year should be 10 pounds, 12 pounds, 18 pounds, 21 pounds. A birth weight of 7 pounds would indicate 21 pounds in 1 year, as weight usually triples by the first birthday. Question 8. A client is admitted with a Ewing sarcoma. Which symptoms would be expected due to this tumor's location? Hemiplegia, aphasia, nausea, bone pain. Sarcoma is a type of bone cancer, therefore, bone pain would be expected. Question 9. The nurse is caring for a client with epilepsy who is being treated with carbamazepine, Tegretol. Which laboratory value might indicate a serious side effect of this drug? Uric acid of 5 mg/dl, hematocrit of 33%, WBC 2000 per cubic millimeter, platelets 150,000 per cubic millimeter. Tegretol can suppress the bone marrow and decrease the white blood cell count. A WBC of 2000 indicates a side effect. Question 10. A 6-month-old client is admitted with possible intussusception. Which question during the nursing history is least helpful in obtaining information regarding this diagnosis? Tell me about the pain. What does his vomit look like? Describe his usual diet. Have you noticed changes in his abdominal size? Dietary history is least helpful for intussusception. Symptoms like pain, vomiting, and abdominal size are clinical indicators. Question 11. The nurse is assisting a client with diverticulosis to select appropriate foods. Which food should be avoided? Bran, fresh peaches, cucumber salad, yeast rolls. The client with diverticulosis should avoid foods with seeds, like those found in cucumbers. Question 12. A client has rectal cancer and is scheduled for an abdominal perineal resection. What should be the priority nursing care during the post-op period? teaching how to irrigate the ileostomy, stopping electrolytes loss in the incisional area, encouraging a high-fiber diet, facilitating perineal wound drainage. Perineal drains facilitate drainage and prevent infection at the surgical site. The client will have a colostomy, not an ileostomy. Question 13. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on low roughage diet. Which food would have to be eliminated from this client's diet? Roasted chicken, noodles, cooked broccoli, custard. The client should avoid eating foods that are gas-forming and increase discomfort, such as cooked broccoli. Question 14. The nurse is caring for a new mother. The mother asks why her baby has lost weight since he was born. The best explanation is, the baby is dehydrated due to polyuria. The baby is hypoglycemic due to glucose. The baby is allergic to the formula. The baby can lose up to 10% of weight due to meconium stool and loss of extracellular fluid. Infants can lose up to 10% of birth weight due to meconium, fluid loss, and the transition to feeding. Question 15. The nurse is caring for a client with laryngeal cancer. Which finding in the health history would not be common for this diagnosis? Foul breath, dysphagia, diarrhea, chronic hiccups. Diarrhea is not a common finding in laryngeal cancer, whereas dysphagia and foul breath are common. Question 16. A removal of the left lower lobe of the lung is performed on a client with lung cancer. Which postoperative measure is included? Closed chest drainage, a tracheostomy, a mediastinal tube, percussion vibration and drainage. The client with a lung resection will have chest tubes and a closed chest drainage collection device. Question 17. 6 hours after birth, an infant is found to have swelling over the right parietal area that does not cross the suture line. Chart as a cephalohematoma, molding, subdural hematoma, caput succedaneum. Cephalohematoma is bleeding beneath the periosteum and does not cross suture lines. Question 18. The nurse is assisting with discharge instructions for a client with an implantable defibrillator. What is essential? You cannot eat food prepared in a microwave. Avoid moving the shoulder on the side of the pacemaker site for 6 weeks. You should use your cell phone on your right side. You will not be able to fly on a commercial airliner. Cell phones should be used on the side opposite the internal defibrillator to avoid interference. Question 19. A client in the cardiac step-down unit requires suctioning. Monitor the client for which dysrhythmia during this procedure: bradycardia, tachycardia, premature ventricular beats, heart block. Suctioning can stimulate the vagus nerve and cause a vagal response resulting in bradycardia. Question 20. The nurse is caring for a client scheduled for a surgical repair of an abdominal aortic aneurysm. Which assessment is most crucial pre-op? Assessment of the client's level of anxiety, evaluation of the client's exercise tolerance, identification of peripheral pulses, assessment of bowel sounds and activity. Identifying peripheral pulses is crucial to establish a baseline for postoperative circulation assessment. Question 21. A client with suspected renal disease is to undergo a renal biopsy. Include which statement in the teaching session? You will be sitting for the procedure. Portions of the procedure will cause pain or discomfort. You will be given medication to anesthetize the area. You will not be able to drink fluids for 24 hours before. The client should be informed that parts of the procedure, specifically the sample withdrawal, can be painful. Question 22. The nurse is performing an assessment on a client with possible pernicious anemia. Which data would support this diagnosis? A weight loss of 10 pounds in 2 weeks, numbness and tingling in the extremities, a red, beefy tongue, a hemoglobin level of 12.0 gm/dl. A red, beefy tongue is a classic characteristic finding in clients with pernicious anemia. Question 23. A client arrives in the emergency room with a possible fractured femur. The nurse should anticipate an order for Trendelenburg position, ice to the entire extremity, Buck's traction, an abduction pillow. Buck's traction helps realign the leg, decrease muscle spasms, and manage pain in femur fractures. Question 24. A client with cancer is to undergo an intravenous pyelogram. The nurse should Force fluids 24 hours before the procedure. Ask the client to void immediately before the study. Hold CNS medication for 12 hours. Cover reproductive organs with an X-ray shield. Voiding before the study prevents a full bladder from obscuring the visualization of the urinary tract. Question 25. The nurse is caring for a client with a malignancy. The classification of the primary tumor is TIS, plan care for a tumor that cannot be assessed, that is in situ, with increasing lymph node involvement, with distant metastasis. TIS indicates carcinoma in situ, meaning the cancer is still localized at the primary site. Question 26. A client's wound eviscerates after a coughing episode 2 days post-op. Which nursing action is most appropriate? Reinsert the protruding organ and cover. Cover the wound with a sterile 4x4 and ABD dressing. Cover the wound with a sterile saline-soaked dressing. Apply an abdominal binder and manual pressure. Eviscerated contents should be covered immediately with sterile dressings soaked in sterile saline. Question 27. Which item is most important to remove before sending the client to surgery? Hearing aid, contact lenses, wedding ring, artificial eye. Removing contact lenses is vital to prevent corneal drying and injury during anesthesia. Question 28. The consent form is signed, but the client is unclear about surgery and complications. Which is the most appropriate action? Call the surgeon to see the client and clarify. Explain the procedure and complications to the client. Check the physician's progress notes. Check with the client's family. The physician is responsible for providing informed consent and clarifying the details of the surgery. Question 29. When assessing a client for risk of hyperphosphatemia, which piece of information is most important to obtain? A history of radiation treatment in the neck region, a history of recent orthopedic surgery, a history of minimal physical activity, a history of the client's food intake. Neck radiation can damage the parathyroid glands, interfering with calcium and phosphorus regulation. Question 30. Initial laboratory values reveal serum sodium of 170 milliequivalent/L. What behavioral changes would be common for this client? Anger, mania, depression, psychosis. Hypernatremia, sodium 170, can manifest as neurologic excitement or manic behavior. Question 31. Which statement made by an 80-year-old client might indicate a possible fluid and electrolyte imbalance? My skin is always so dry. I often use laxatives for constipation. I have always liked to drink iced tea. I sometimes have a problem with dribbling urine. Frequent laxative use can lead to diarrhea and subsequent electrolyte and fluid loss. Question 32. Which statement made by a client's sister signifies abnormal grieving after the death of a parent? My sister still has episodes of crying and it's been 3 months. Sally seems to have forgotten the bad things Daddy did. She said that she had a sense of longing after the funeral. Sally has not been sad at all. She acts like nothing has happened. Lack of grieving or suppression of feelings can be a sign of abnormal or delayed grieving. Question 33. Which of the following would be most appropriate to wear when providing direct care to a client with a cough? Mask, gown, gloves, shoe covers. A mask is the priority item to wear to prevent the spread of respiratory droplets from a coughing client. Question 34. A client with hepatitis is experiencing pruritus. Which is the most appropriate nursing intervention? Suggest the client take warm showers (BID). Add baby oil to the client's bath water. Apply powder to the client's skin. Suggest a hot water rinse after bathing. Baby oil helps soothe dry skin and decrease itching, pruritus, associated with hepatitis. Question 35. A client with pancreatitis has been transferred to the ICU. Which order would the nurse anticipate? Blood pressure every 15 minutes. Insertion of a living tube. Cardiac monitoring. Dressing changes 2x per day. Nasogastric, living, tubes are used to decompress the stomach and rest the bowel in pancreatitis. Question 36. Montgomery straps are utilized on a client after a cholecystectomy because the client is at risk for evisceration. The client will require frequent dressing changes. The straps provide support for drains. No sutures or clips are used. Montgomery straps prevent skin irritation from frequent tape removal during multiple dressing changes. Question 37. The physician has ordered medication administered intrathecally. This means administered intravenously, rectally, intramuscularly, into the cerebrospinal fluid. Intrathecal medications are injected directly into the cerebrospinal fluid, CSF. Question 38. Which client can be best assigned to a newly licensed practical nurse? The client receiving chemotherapy, the client post-coronary bypass, the client with a TURP, the client with diverticulitis. The newly licensed PN should be assigned the most stable client, which is the client with diverticulitis. Question 39. The nurse notes a PCA looking through the personal items of a client with cancer. RN action. Notify the police department. Report this behavior to the charge nurse. Monitor the situation. Ignore the situation until items are missing. Reporting the incident to the charge nurse is the appropriate initial step in the chain of command. Question 40. The nurse overhears the PCA speaking harshly to a client with dementia. The charge nurse should change the nursing assistant's assignment, explore the interaction with the nursing assistant, discuss the matter with the client's family, initiate a group session. Exploring the interaction allows for clarification and correction of the behavior. Question 41. A home health nurse is planning visits. Which client should be visited first? A client with AIDS on foscarnet, a client with a fractured femur in a cast, a client with laryngeal cancer with a laryngectomy, a client with diabetic ulcers. Airway is priority. The client with a laryngectomy has a potential for airway alteration. Question 42. An infant has physiologic jaundice. Which action would facilitate elimination of bilirubin? Increase the infant's fluid intake, maintain body temp at 98.6 F, minimize tactile stimulation, decrease caloric intake. Bilirubin is excreted through the kidneys and stool. Increased fluids facilitate this process. Question 43. Goal for a ventilator-supported client pending organ donation. Maintain systolic blood pressure at 70 mmHg or greater. Maintain urinary output greater than 300 cubic centimeters per hour. Maintain body temp of 33 F rectal. Maintain hematocrit less than 30%. Maintaining SBP above 70 ensures adequate perfusion to the donor organs. Question 44. Which action by the novice nurse indicates need for further teaching? Fails to wear gloves to remove a dressing. Applies oxygen saturation monitor to the earlobe. Elevates the head of the bed to check BP. Places the extremity dependent to acquire blood sample. Standard precautions require wearing gloves when handling dressings and potentially infectious fluids. Question 45. Preparing the client for a mammogram. The nurse should tell the client, restrict fat intake for 1 week. Omit creams, powders, or deodorants before the exam. Mammography replaces self-breast exams. Requires higher doses of radiation than an X-ray. Deodorants and powders can appear as abnormal spots or calcifications on the mammogram. Question 46. Which roommate would be best for a client with a gastric resection? A client with Crohn's disease, a client with pneumonia, a client with gastritis, a client with phlebitis. Phlebitis is a non-infectious inflammatory condition, making it the safest roommate choice. Question 47. Which client should be cared for by the RN? A client 2 days post-appendectomy, a client 1 week post-thyroidectomy, a client 3 days post-splenectomy, a client 2 days post-thoracotomy. The most critical client, 2 days post-thoracotomy, requires the assessment skills of the RN. Question 48. Observation of graduate nurse assessment of CVP indicates need for further teaching. Places client in supine position. Turns stopcock off from fore fluid to client. Instructs client to perform Valsalva maneuver. Notes level at top of meniscus. The client should breathe normally during CVP measurement to ensure an accurate reading. Question 49. Which roommate is most suitable for a client with myasthenia gravis? A client with hypothyroidism, a client with Crohn's disease, a client with pyelonephritis, a client with bronchitis. A client with hypothyroidism is generally quiet and less likely to cause stress for the MG client. Question 50. ER triage for 4 clients. Which client should receive priority? 10-year-old with face lacerations, 15-year-old with sternal bruising, 34-year-old with fractured femur, 50-year-old with dislocated elbow. Sternal bruising can indicate cardiac or pulmonary contusion and potential airway/oxygen issues. Question 51. If the dialysate returns cloudy during peritoneal dialysis, the nurse should document the finding, send a specimen to the lab, strain the urine, obtain a complete blood count. Cloudy dialysate is a sign of peritonitis and must be cultured to identify infection. Question 52. The client with cirrhosis is receiving lactulose. The reason is to lower the blood glucose level, to lower the uric acid level, to lower ammonia level, to lower the creatinine level. Lactulose is used in cirrhosis to reduce ammonia levels and prevent hepatic encephalopathy. Question 53. Which statement by a diabetic client indicates a need for follow-up after discharge? I live by myself. I have trouble seeing. I have a cat in the house. I usually drive myself to the doctor. Visual impairment can interfere with the client's ability to accurately measure and inject insulin. Question 54. Which lab should be evaluated while the client is receiving total parenteral nutrition, TPN, hemoglobin, creatinine, blood glucose, white blood cell count? TPN has a very high glucose content, making blood glucose monitoring essential. Question 55. The client with ME says there is nothing wrong and wants to go home. Mechanism, rationalization, denial, projection, conversion reaction. The client is refusing to acknowledge the reality of the illness, which is a sign of denial. Question 56. Which lab test is least effective in making the diagnosis of myocardial infarction? AST, troponin, CKMB, myoglobin. AST is found in many tissues and is not specific for diagnosing myocardial damage. Question 57. Which woman is not a candidate for ROGAM? Gravida 4, Rh negative, Rh positive baby. Gravida I, Rh negative, Rh positive baby. Gravida 2, Rh negative, stillbirth delivery. Gravida 4, Rh negative, Rh negative baby. If the baby is also Rh negative, there is no risk of isoimmunization and ROGAM is not needed. Question 58. The first exercise that should be performed by a client with a mastectomy is walking the hand up the wall, sweeping the floor, combing her hair, squeezing a ball. Squeezing a ball is the safest initial exercise to promote circulation without pulling on incisions. Question 59. Which medication should be kept at the bedside during a tensilin test? Atropine sulfate, furosemide, prostigmine, promethazine. Atropine is the antidote for tensilin, edrophonium, in case of a cholinergic crisis. Question 60. Instruction given to the client before a paracentesis. You will lay flat during the exam. Empty your bladder before the procedure. You will be asleep. Doctor will inject medication to treat illness during. An empty bladder reduces the risk of accidental puncture during the procedure. Question 61. To ensure safety while administering a nitroglycerin patch, the nurse should wear gloves, shave the area, wash area with hot water, apply to the buttocks. Gloves prevent the nurse from absorbing the medication through their own skin. Question 62. 25-year-old with a piece of metal in his eye. Which action is correct? Use a magnet, rinse with saline, cover both eyes with paper cups, patch affected eye only. Covering both eyes prevents consensual movement that could further damage the injured eye. Question 63. Sodium warfarin, Coumadin, for thrombophlebitis should be administered at 0900, 1200, 1700, 2100. Coumadin is given in the late afternoon to allow morning labs, point/INR, to guide the dose. Question 64. The disruptive schizophrenic requires seclusion. Who can legally institute this? Security guard, RN, LPN, nursing assistant. Seclusion is a restrictive intervention that must be initiated by an RN or physician. Question 65. COPD, pH 7.36, CO245, O284, HCO328. Assess the client to be in uncompensated acidosis, compensated alkalosis, compensated respiratory acidosis, uncompensated metabolic acidosis. The pH is normal but acidic, and both CO2 and HCO3 are elevated, indicating compensation. Question 66. The best way to assess pain is to take vital signs, ask client to rate pain 1 to 5, watch facial expression, ask if they are in pain. Subjective pain scales are the most reliable tool for assessing pain levels. Question 67. Effective means of managing discomfort associated with an episiotomy after discharge: promethazine, aspirin, sitz bath, ice bath. Sitz baths promote healing and provide comfort by increasing circulation to the area. Question 68. Appropriate post-op diet for a client after a hemorrhoidectomy: high fiber, low residue, bland, clear liquids. Clear liquids are started post-op to minimize bowel movements until the site begins to heal. Question 69. A culture for suspected gonorrhea should be obtained from blood, nasopharyngeal secretions, stool, genital secretions. Gonorrhea is a sexually transmitted infection diagnosed via genital secretion cultures. Question 70. Provide frequent rest periods for a client with cerebral palsy because relaxation decreases movements, rest activates reflexes, rest increases stretch reflexes, fine motor moves improve. Rest periods help reduce the involuntary movements and fatigue associated with CP. Question 71. Which client should be assigned to the nursing assistant? A client with Alzheimer's, a client with pneumonia, a client with appendicitis, a client with thrombophlebitis. The Alzheimer's client is the most stable and requires help with ADLS, which is in the NA scope. Question 72. A cancer client develops xerostomia. The nurse can help by offering hard candy, administering an analgesic, splinting joints, providing saliva substitute. Xerostomia is dry mouth. Saliva substitutes are the most effective treatment. Question 73. Home health visit priority: brain attack with tube feeding, CHF with nighttime dyspnea, thoracotomy 6 months ago, Parkinson disease. Nighttime dyspnea suggests worsening heart failure and respiratory distress, priority. Question 74. Glomerulonephritis low sodium snack: peanut butter cookies, grilled cheese sandwich, cottage cheese and fruit, fresh peach. Fresh fruit like a peach is naturally low in sodium compared to processed snacks. Question 75. Which client should be transferred to the postpartum unit? 66-year-old female with gastroenteritis, 40-year-old female with a hysterectomy, 27-year-old male with depression, 28-year-old male with colitis. Hysterectomy care aligns well with the skills of postpartum nurses, monitoring bleeding. Question 76. Narcotic discrepancy found. First action: notify pharmacist, notify nursing supervisor, notify board of nursing, notify director of nursing. The immediate supervisor must be notified to begin the investigation and follow protocol. Question 77. Assignment given to the nursing assistant, pediatrics: vital signs of 5-month-old with bronchiolitis, vital signs of 10-year-old 2 days post-appendectomy, administering meds to 2-year-old, adjusting traction of 1-year-old. The 10-year-old post-op client is the most stable and appropriate for a nursing assistant. Question 78. Graduate charts LPN before receiving results: charge, fraud, tort, malpractice, negligence. Misrepresenting oneself as licensed when one is not is considered fraud. Question 79. Leukemia with low WBC count. In addition to isolation, disposable utensils, wear mask for visitors, prep for with mild soap, provide foods in sealed single-serving packages. Sealed packages minimize the risk of foodborne contaminants in immunocompromised clients. Question 80. Recovering stroke client exhibits unilateral neglect, suggested by shading only one side of face, unable to distinguish tactile stimuli, turning head side to side, unable to carry out motor activity. Ignoring one side of the body or environment is the hallmark of unilateral neglect. Question 81. Discharge teaching for disulfiram and taboos. Avoid eating peanuts, dates, figs, chocolate, pickles, salad with vinaigrette, milk, cottage cheese. Antabuse causes a severe reaction to alcohol. Vinaigrette and pickles often contain vinegar/alcohol. Question 82. Lab finding indicating B12, cyanocobalamin, is working for pernicious anemia. Neutrophil count 60%, basophil count 0.5%, monocyte count 2%, reticulocyte count 1%. Reticulocyte count increases as the body begins producing new red blood cells correctly. Question 83. Nurse assesses first after shift report. 2 hours post-lobectomy with 150 cubic centimeters drainage. 2 days post-gastrectomy with scant drainage. Pneumonia with temp 102F, fractured hip and buccal traction. The early post-op client is the least stable and has the highest risk of complication. Question 84. ER disaster share room. Schizophrenic and colitis. Pregnant with abdominal pain and facial lacerations. Fixed pupils and head injury. Puncture wound and chest pain. These two clients are relatively stable compared to the others and do not conflict. Question 85. Home health nurse seen first. Gastrectomy 3 weeks ago with PEG. 5-month-old with pneumonia. 50-year-old with MRSA on PIC. 30-year-old with MS on cortisone via central line. Clients with central lines and systemic steroid therapy are at high risk and priority. Question 86. Nurse guilty of charting without performing procedure. Charge nurse action. Call the board of nursing. File a formal reprimand. Terminate the nurse. Charge with a tort. A formal reprimand is the appropriate disciplinary step for initial documentation errors. Question 87. Information reported to the State Board of Nursing. Facility fails to provide Spanish literature. Narcotic count incorrect for 3 days. Client fails to receive itemized bill. Now fails to feed client. Inaccuracies in controlled substance counts are a significant legal and professional violation. Question 88. Nurse assigned to care for postpartum client with preeclampsia. 2 weeks experience on postpartum. 3 years experience in L&D, 10 years experience in surgery. 1 year experience in NICU. L&D experience is most applicable to managing the complications of preeclampsia. Question 89. Post-op, BP 90/50ths, pulse 132, RESP 30. Priority, continue to monitor, contact the physician, ask client how he feels, ask LPN to continue care. These vital signs suggest shock or hemorrhage and require immediate medical intervention. Question 90. Assignment not for the LPN. Inserting a Foley, discounting a tube, obtaining sputum specimen, initiating a blood transfusion. Initiating blood products is typically outside the scope of practice for an LPN. Question 91. Nurse witness is not hitting client. Charge, negligence, tort, assault, malpractice. Intentionally striking a client is a criminal and civil act defined as assault. Question 92. Private room if only one available. Cushing's disease, diabetes, acromegaly, myxedema. Cushing's disease clients are immunocompromised due to high cortisol levels. Question 93. Assigned to the pregnant nurse. Linear accelerator radiation, radium implant cervical cancer, soluble brachytherapy thyroid cancer, iridium seeds prostate cancer. Linear accelerator therapy does not make the client radioactive, the other options do. Question 94. Reverses the effects of heparin, cyanocobalamin, protamine sulfate, streptokinase, sodium warfarin. Protamine sulfate is the specific pharmacological antagonist, antidote, for heparin. Question 95. Lasix 40 mg Forstat for BP 210/120, administer, over 1 to 2 minutes, for piggyback, with normal saline only, through venous access device. For Lasix should be pushed slowly to prevent sudden hypotension and ototoxicity. Question 96. Adverse reaction to captopril, capoten, tinnitus, persistent coughing, muscle weakness, diarrhea. ACE inhibitors like capoten frequently cause a persistent, dry, non-productive cough. Question 97. Application of 2% nitroglycerin ointment, rotating application sites, limit to chest, rub into skin, cover with gauze dressing. Site rotation prevents skin irritation and improves absorption. Question 98. Lidocaine is ordered for atrial tachycardia, ventricular tachycardia, heart block, ventricular bradycardia. Lidocaine is a class 1B antiarrhythmic used primarily for ventricular dysrhythmias. Question 99. Quinidine sulfate, monitor ECG for peak P waves, elevated ST segment, inverted T wave, prolonged QT interval. Quinidine can cause toxicity manifested as prolonged QT and potential heart block. Question 100. Tranylcypromine sulfate, parnate, avoid tyramine to prevent hypertension, hyperthermia, melanoma, urinary retention. MAOIs like parnate interact with tyramine-rich foods to cause hypertensive crisis. Question 101. Side effect of phenytoin, dilantin, irritability, sleepiness, gums look too big, gingival hyperplasia, weight gain. Gingival hyperplasia is a very common side effect of long-term phenytoin use. Question 102. Indicator of complication after tonsillectomy, decreased appetite, low-grade fever, chest congestion, constant swallowing. Frequent swallowing is a sign of active bleeding from the surgical site. Question 103. Cerebral palsy functioning at 18-month level, supporting finding, dresses herself, pulls a toy behind her, builds tower of 8 blocks, copies a horizontal line. Pulling a toy is a typical 18-month-old developmental milestone. Question 104. Individual at greatest risk for hypertension, 45-year-old African American attorney, 60-year-old Asian American shop owner, 40-year-old Caucasian nurse, 55-year-old Hispanic teacher. African Americans have a higher prevalence and risk of developing hypertension. Question 105. 15-year-old ingested acetaminophen 45 minutes ago, order first, gastric lavage, administer acetylcysteine, start 4D5W, drink activated charcoal. Gastric lavage is prioritized within the first hour of ingestion to remove the substance. Question 106. Monitor for which complication 24 hours after cardiac catheterization, angina at rest, thrombus formation, dizziness, falling blood pressure. Thrombus formation at the insertion site is a major risk post-cardiac catheterization. Question 107. Renal calculi with flank pain and nausea, priority goal, maintain fluid balance, control nausea, manage pain, prevent UTI. Acute pain management is the priority in the symptomatic phase of renal calculi. Question 108. Expected growth during school-age years, decreasing fat and muscle, little change in appearance, height increase of 4 inches yearly, weight gain of 5.5 pounds per year. School-age children typically gain about 5 to 7 pounds per year. Question 109. BP 160/96 at community fair. Nurse should tell client, BP check in 15 minutes, Check BP in 2 months. See provider immediately. Visit provider within 1 week. A high reading should be followed up within a week to confirm a diagnosis of hypertension. Question 110. Levothyroxine, Synthroid, teaching emphasizes, should be taken in the morning, may decrease energy level, store in dark container, will decrease heart rate. Synthroid should be taken on an empty stomach in the morning for best absorption. Question 111. Sudden muffled voice and drooling in 3-year-old. First, prepare for X-ray of upper airways, examine the child's throat, collect sputum, notify provider. Epiglottitis is suspected, X-ray is needed, and the throat should never be examined manually. Question 112. Prompts parents to take school-age child for diabetes evaluation, polyphagia, dehydration, bedwetting, weight loss. New-onset bedwetting, enuresis, is a frequent reason parents seek help for childhood diabetes. Question 113. Recurrent pelvic inflammatory disease follows which infection? Trichomoniasis, chlamydia, staphylococcus, streptococcus. Chlamydia and gonorrhea are the most common causes of pelvic inflammatory disease. Question 114. Education for SL-nitroglycerin, stinging/burning under tongue, blurring of vision, urticaria, urinary frequency. The stinging/burning sensation indicates that the medication is fresh and potent. Question 115. Contraindicated for hypertrophic cardiomyopathy, positive inotropes, vasodilators, diuretics, antidysrhythmics. Positive inotropes, like digoxin, increase the obstruction in hypertrophic cardiomyopathy. Question 116. Remember regarding fluoxetine, Prozac, precipitate hypertensive crisis, therapeutic effect 2 to 4 weeks, avoid aged cheese, safe with MAOIs. SSRIs like Prozac take several weeks to reach full therapeutic effect. Question 117. Most common STDs in the United States: chlamydia, herpes genitalis, syphilis, gonorrhea. Chlamydia remains the most frequently reported bacterial STD in the U.S. Question 118. Psychotic client believes he is God, delusion, somatic, grandiose, persecutory, nihilistic. Delusions of grandeur, grandiose, involve inflated self-worth or power. Question 119. Characteristic rash of chickenpox, vesicular scabs in macular stage, appears on neck first, slap cheek appearance, profusely on trunk and sparsely on extremities. Varicella rash is most concentrated on the trunk, centripetal distribution. Question 120. Elevates or potentiates serum digoxin levels, KCl, thyroid agents, quinidine, theophylline. Quinidine significantly increases digoxin levels and risk of toxicity. Question 121. C3/4 fracture arriving in ER, primary intervention, stabilization of cervical spine, airway assessment and stabilization, confirmation of injury, normalization of volume. Airway is the absolute priority, especially with high cervical injuries affecting the diaphragm. Question 122. Characteristics of hepatitis C, potential for chronic disease minimal, abrupt onset, incubation 2 to 26 weeks, effective vaccine exists. HCV has a long incubation period and a high rate of progression to chronic disease. Question 123. Therapeutic blood level range for lithium, 0.25 to 1.0 milliequivalent/L, 0.5 to 1.5 milliequivalent/L, 1.0 to 2.0 milliequivalent/L, 2.0 to 2.5 milliequivalent/L. The therapeutic window for lithium is narrow, typically 0.5 to 1.5 milliequivalent/L. Question 124. Diabetes type I, BG50 at 4:30 p.m. Action: sugar dissolved in juice, 3 pieces of hard candy, drink 4 ounces of orange juice, monitor until dinner. 4 ounces of juice is a standard simple carbohydrate for treating mild hypoglycemia. Question 125. Morphine 4 for burn pain because delays absorption, facilitates absorption, allows for discontinuance, avoids pain from IM. Tissue perfusion is unreliable in severe burns, making IM absorption unpredictable. Question 126. Monitor for bronchospasm and COPD/asthma with verapamil, amrinone, epinephrine, propranolol. Non-selective beta blockers like Inderal can cause severe bronchoconstriction. Question 127. Medication that best penetrates eschar: mefenide acetate, sulfamylin, silver sulfadiazine, neomycin, povidone. Sulfamylin is uniquely able to diffuse through thick burn eschar. Question 128. Monitor serum glucose levels with which medication: norepinephrine, dobutamine, propranolol, epinephrine. Epinephrine stimulates glycogenolysis, which can lead to elevated blood glucose. Question 129. Differentiates acute from chronic respiratory acidosis: increased PaCO2, decreased PaO2, increased HCO3, decreased base excess. In chronic respiratory acidosis, the kidneys retain bicarbonate, HCO3, to compensate. Question 130. Initial treatment for liquid chemical burn: neutralizing solutions, flush with large amounts of water, inject calcium chloride, apply lanolin. Immediate, continuous irrigation with water is the standard for chemical burns. Question 131. 10U regular insulin at 9 a.m., peak action, 9:30 a.m., 10:30 a.m., 12 noon, 4 p.m. Regular insulin typically peaks 2 to 4 hours after subcutaneous injection. Question 132. Dopamine extravasation medication: phentolamine, regutine, epinephrine, phenylephrine, sodium bicarbonate. Regutine is used to prevent tissue necrosis following dopamine extravasation. Question 133. Discharge teaching for atopic dermatitis: high humidified environment, soft stuffed animals, showering 3 to 4 times daily, wrapping hands in soft cotton gloves. Gloves help prevent scratching and secondary infection in children with dermatitis. Question 134. Priapism may be a sign of altered neurological function, imminent death, urinary incontinence, reproductive dysfunction. Priapism can occur as a result of spinal cord injury or autonomic dysfunction. Question 135. Symptoms of neurogenic shock differ from hypovolemic in that, in neurogenic shock, the skin is warm and dry; in hypovolemic, bradycardia; in hypovolemic, refill twos; in neurogenic, delayed refill. Loss of sympathetic tone in neurogenic shock leads to vasodilation and warm/dry skin. Question 136. Bipolar disorder assessment findings: short, polite responses, introspection, exaggerated self-importance, helplessness. Grandiosity and exaggerated self-importance are hallmarks of the manic phase of bipolar. Question 137. Receding IM vasopressin tannate care: weigh once a week, limit fluid to 500 ml, store in refrigerator, warm vial and shake vigorously. The oil suspension must be warmed and shaken to ensure the medication is properly mixed. Question 138. Cardinal signs of diabetes insipidus: anemia and vomiting, polyuria and polydipsia, irritability relieved by feeding, hypothermia and azotemia. Excessive urination and excessive thirst are the primary symptoms of D. Question 139. Supracondylar fracture of femur: ischemia signs, bleeding/bruising, creatinine increase, pain, pallor, pulselessness, paresthesia, paralysis, muscle rigidity. These are the 5 Ps of neurovascular compromise and ischemia. Question 140. Allergy attack sign: wheezing on inspiration, increased respiratory rate, circumoral cyanosis, prolonged expiration. Air trapping and difficulty with exhalation cause prolonged expiration in allergic asthma. Question 141. Alcohol safe during pregnancy: up to 1 ounce daily, up to 2 ounces daily, up to 4 ounces weekly, no alcohol. There is no known safe amount of alcohol during pregnancy, absolute avoidance is advised. Question 142. Breast cancer risk factor significant in history: menarche after age 13, nulliparity, maternal family history, early menopause. A first-degree relative with breast cancer significantly increases an individual's risk. Question 143. Emphysema shortness of breath intervention: increase O2 to 6L/min lateral Sims position, encourage pursed lip breathing, breathe into paper bag. Pursed lip breathing helps maintain airway pressure and improves gas exchange. Question 144. Sign of chlamydia in male adolescent: enlarged penis, secondary lymphadenitis, epididymitis, hepatomegaly. Epididymitis is a common complication of untreated chlamydia in males. Question 145. Evaluate mediastinal position by auscultating breath sounds, palpating crepitus, palpating for tracheal deviation, auscultating heart sounds. A shifted trachea indicates a shift in the mediastinum, example, tension pneumothorax. Question 146. Long-term goal for suicidal client: safe environment, develop more effective coping mechanisms, sign no suicide contract, isolate from stress. Coping skill development is essential for long-term safety and recovery. Question 147. Foods to avoid potassium depletion: celery, potatoes, tomatoes, liver. Tomatoes are a good source of potassium to counteract diuretic-induced loss. Question 148. Toxic effect of phenytoin, dilantin, therapy: Stevens-Johnson syndrome, folate deficiency, leukopenic aplastic anemia, granulocytosis and nephroses. SJS is a rare but life-threatening hypersensitivity reaction to phenytoin. Question 149. C4 injury autonomic dysreflexia signs: dizziness and tachypnea, circumoral pallor, headache and facial flushing, pallor and itching. Severe headache and flushing above the level of injury are classic signs. Question 150. Waterhouse-Friderichsen syndrome is: peripheral circulatory collapse, SIAD, cerebral edema, auditory nerve damage. This is a catastrophic adrenal hemorrhage and collapse associated with meningococcemia. Question 151. Feeding 4-month-old with diarrhea: fruit juices, diluted carbonated drinks, soy-based, lactose-free formula, regular formula. Soy-based formula is easier to digest and prevents lactose-induced worsening of diarrhea. Question 152. Lithium, ringing in ears, blurred vision, diarrhea, action: administer lithium stat, expected response, request stat blood lithium level, give lithium antidote. These are signs of lithium toxicity, serum levels must be checked immediately. Question 153. PIH admission approach: stress husband's wants, explore perceptions, repeat MD reasons, explain responsibility. Exploring the client's concerns promotes therapeutic communication and compliance. Question 154. Symptoms of first trimester physical changes: nausea and vomiting, quickening, 6 to 8 pounds weight gain, abdominal enlargement. Morning sickness/nausea is a characteristic sign of the first trimester. Question 155. Pregnancy serum glucose range: 70 mg/dl and 120 mg/dl, 100 mg/dl and 200 mg/dl, 40 mg/dl and 130 mg/dl, 90 mg/dl and 200 mg/dl. Tight glycemic control, 70 to 120, is required to prevent maternal and fetal complications. Question 156. Severely depressed client suddenly feels better. Risk: suicide, exacerbation, violence, psychosis. Increased energy after severe depression often gives the client the means to carry out suicide. Question 157. Burn 18 to 24 hours after. Expected change: elevated serum sodium, elevated serum calcium, elevated serum protein, elevated hematocrit. Fluid shifts from the vascular to the interstitial space result in hemoconcentration. Question 158. ADA caloric guidelines: 50% carb, 20% protein, 20% fat, 45% carb, 25% protein, 30% fat, 70% carb, 20% protein, 10% fat, 60% carb, 12% to 15% protein, 20% to 25% fat. Standard recommendations prioritize complex carbs and moderate protein/fat. Question 159. Increased myocardial work and O2 demand occurs with positive inotropic therapy, negative chronotropic therapy, balance of O2 supply, afterload reduction. Positive inotropes increase the force of contraction, thereby increasing O2 consumption. Question 160. Important prognostic factor for breast cancer: tumor size, axillary node status, previous history, estrogen receptor assays. The spread of cancer to the axillary nodes is the most significant indicator of prognosis. Question 161. Depressed response to "My life is so bad, it concerns me, be patient, you are feeling hopeless at this point, let's play cards." Reflection and validation are therapeutic when dealing with expressions of hopelessness. Question 162. 6-month-old febrile seizures teaching: temperature over 103 F related, do not usually recur, little risk of neurological deficit, associated with CNS disease. Febrile seizures are generally benign and not associated with long-term brain injury. Question 163. Hepatitis therapeutic diet: high protein and low carb, low calorie and low protein, high carb and high calorie, low carb and high calorie. High calories and carbs are needed to support liver repair and meet energy demands.